The doctor is in.
Salutations, this is your pal Dr. Sal. Today we're going to take a look at croup. Every year around Halloween time, rolling into the province of Santa Claus, kids start coming down with coughs. So in this episode we're going to look at if your little one's suffering with a cough, is it croup? And I'll show you the 5 most common symptoms that will allow you to identify croup as well as me. Let's go. So what exactly is croup? Well, croup is a viral illness, typically the influenza family, RSV, etc., a whole bunch of nasties, that tends to be characterized by causing respiratory distress in kids. And typically the kids are 6 months to 6 years of age. It is also a little bit more common in boys by about 1.5 times ratio to girls. And this illness likes to rear its head in as the months tend to cool down, so typically in fall, aka autumn, and winter. So it's more of a northerly type illness. Interestingly enough, the term croup actually comes from an old Scottish term for the sounds that ravens make. So I queued up an example here of how ravens sound. Now, just by luck, my son had it this week, which made it a little poignant and brought it to mind. So in a couple of minutes after we discuss just a few facets about the illness, I'll actually show you an example of it and how successful quick treatment can be. Now, like I said, it's fairly common as the winter months roll around, and the typical symptoms, and like I said, I'll show you this in a sec. The typical symptoms, the most common thing that stands out for most people is the barking cough, bark or seal-like. And again, I'll show you this in a sec. The other thing is hoarseness. And in addition, then you can have other common cold symptoms, so like runny nose, fever. And typically the fever isn't very high. It's, typically I see between 37.5 Celsius and under 40 degrees. The kid also tends to look unwell. They don't look very happy. And the sine qua non is something called stridor, which is a noisy set of breathing because of turbulent airflow as it's being impeded on its path. So I'm just going to cut away and show you exactly what I'm talking about here. So if you look on this little diagram here, this obviously is your nasal passages, your mouth. This is your swallow pipe here, or esophagus. And in the front here, there's your Adam's apple. In the front here, you can see here, that's the vocal cords. And right here is the glottic area and subglottic area. This is the region here, whoops. That is the region there that's affected by these viruses. That's why your voice becomes hoarse, because it's right by the vocal cords. And why you also get this stridor sound as you're breathing. That's your windpipe. So if you get swelling in there, it's going to cause noisy breathing, because instead of breathing through a pipe, you're now breathing through a straw. So it's much more turbulent. Turbulence creates noise. And it's kind of important there, just for you academics out there, there's this operates on the principle of something called Poiseuille's rule, which is a French function that dictates that the flow through a tube is equal to pi, because it's a circle that we're dealing with, so pi is usually involved there, p r cubed over 8 and L. Now forget all these other terms. The important term here is the R, which stands for radius. Now as you notice, it's a power law, it's cubed. So what this is telling you, that in that little diagram there of the esophagus, that varies, sorry, not the esophagus, of the subglottic and glottic area, All you need is very small changes in the diameter of the airway from infection from these various viruses causing edema, aka swelling in that tube, to cause magnified misery. So you don't need much change in size to drastically reduce your airflow. So for most kids is more of a nuisance, but a few kids every year, the symptoms are severe enough that you actually have to carry them into hospital to get treatment, and rarely actual intubation. So what I'm going to do now is cut away to my son. Can you do a cough? He had the barking cough, the hoarseness. He looked unwell, and as he was breathing out, you could hear that obstruction in airflow, which we call stridor. Now, in terms of prescriptions, some people will recommend simple things like getting cool moist air, and giving them lots of liquids to help with the secretions. My personal feeling, however, is it's a lot better to see one of my colleagues and get traditional medicine for it. The treatment is very simple and very effective. So what we typically use is a puffer, or maybe 2 puffers, one for dilation and a steroid, and a chemical called dexamethasone. Dexamethasone is an anti-inflammatory steroid. Sorry, that's peeling off the edge of the board there. So this is the exact puffer that I prescribed for my son, and I also gave him a single dose of this dexamethasone chemical, which is an anti-inflammatory that reduces the swelling in that epiglottic area, or subglottic area, sorry, and improves the aperture and airflow. So within 24 hours, and the dexamethasone you can get either in pill form or liquid form. I gave him a tablet form, and like I said, this puffer here is called Flovent, which is also a steroid, aka anti-inflammatory, fluticasone. And let's see how he felt 24 hours later with just 1 dose of that dexamethasone, and a morning application of the puffer and an evening application of the puffer.
Or a cough.
Breathe first and then give us a cough. Yes, a lot better, isn't it? Whoa, dramatic improvement in 1 day. And that is why, ladies and gentlemen, I recommend rather than trying to treat this from home, just go and see your family doc and get a simple prescription. In addition to that, I think I said in the beginning, there's occasional cases where kids will progress on to much more severe symptoms, and you can arrest that to some degree by acting early like I did here. Lucky for him, his dad is a doc, so he was able to get treatment immediately, and it is spectacularly successful. Now, a few things to look out for in dangerous cases of croup is all these symptoms that we just described there are magnified. So the dominant feature is really severe difficulty breathing. So the stridor becomes very noisy. You can see that the kid is distressed. As they're breathing, you may see their nostrils flaring in and out because they're struggling to get air in and out. You'll see their chest heaving as they're trying to breathe in and out. And they may also be sweaty. You may also notice, this is a real danger sign, if you start seeing around their lips turning kind of blue, that means they're not getting enough oxygen. So typically the easiest way to me of identifying this is real noisy breathing, and it looks like they just finished running a marathon and they're struggling to recuperate. If you see symptoms like that, you definitely need to take your little joy bundle to the ER to see some of my homies there, and they'll fix them right. So in terms of prevention, it's actually really simple. Around Halloween and as winter comes around, the air gets a lot drier and colder. And it's around that time that you start noticing your lips chapping and needing chapstick. And same thing for your fingers. You'll notice they start getting dry and scratchy, irritable, and you have to start putting creams and emollients on them. Well, as on the outside, so on the inside. As you breathe in that frigid, dehumidified, dry air, it also tends to irritate the lining inside of your respiratory tract too, creating lots of little micro nicks and abrasions. That's what makes it so easy and makes you vulnerable for these germs to make their way inside and cause infections, not just for croup, but other respiratory ailments as well that tend to be associated with winter. So the solution is actually really simple. Each night in my kid's bedroom, I use a humidifier. I should have started this up a week ago when I noticed my other little guy starting to get chapped lips, but I let it fly, and as a result, that's how my older boy there got the croup. But the little guy was also starting to get kind of raspy and having a little dry cough this week. I started this up over the last couple of days, and he's been breathing fine since. So how I work it is I just turn it on when they lie down for bed, turn it off when I'm going to bed, and it leaves the room feeling in more of a, it's still not warm like the tropics, but it's a lot more humid, which our respiratory tract seems to like. Remember, according to evolutionists, we came from the sea, so to some degree our respiratory tract and our bodies are basically just bags of water. We like a lot of water, and same thing for the air that we breathe in. We like it to be moist. So ladies and gentlemen, that is Croup in a nutshell. Thank you so much for watching.
Thanks for watching. Get notified of new videos. Subscribe now.
If you found this video helpful, support us by sharing it with all of your friends and throw us a like below. You're a star. Cheers and cheerio.